Welcome to the People's Medical News Channel. Our motto is, medical knowledge is power. And our mission is to educate and advocate for healthcare policies that are sent in by our viewers and healthcare professionals. Today we have a special guest all the way from North Carolina, Mrs. Tyeasha Williams. She is a certified family nurse practitioner and currently a doctorate student at one of the top universities in the United States, Duke University. I would like to thank you for having me here today to discuss this important issue on HPV. I have been a family nurse practitioner for over 1 year. As a family nurse practitioner, I treat individuals with the human papillomavirus, HPV, the virus that causes about 70% of cervical cancers, and today I want to inform you how to prevent this virus from spreading to your daughter, son, niece, nephew or friend. Tyeasha, can you tell us what HPV is? Yes, I can. HPV is one of the most commonly sexually transmitted infections in the world today. HPV infects approximately 20 million people in the U.S. with 6.2 million new cases each year. There are over 100 different types of the HPV virus and over 40 types that can affect the genital areas of males and females. Low-risk HPV viruses can cause genital and anal warts. High-risk HPV viruses can cause precancerous lesions and cancer in the cervix, anus and other genital areas. Most high-risk types cause cervical cancer. Can you tell the viewers how does HPV spread? You can get HPV from vaginal, anal and oral sex. The scariest thing about becoming infected with HPV is that an infected person may not develop any symptoms or health problems. The virus can infect anyone who has ever had a sexual encounter even without penetration. Tyeasha, from what you just said, I understand that you may not experience any physical signs or symptoms. That is absolutely correct. So are there any signs or symptoms that may appear that are related to HPV problems? Yes. When the body does not fight off HPV, it can cause visible changes in the form of genital warts or cancer. The genital warts usually appear as a small bump or a group of bumps in the genital area and can be small, large, raised or flat or shaped like a cauliflower. The warts can appear within weeks or months after getting HPV but will not turn into cancer. One of the most common types of cancer that occurs from HPV is cervical cancer, but these symptoms generally do not appear until the disease has advanced. How prevalent is it for someone to get genital warts and cervical cancer? About 1% of sexually active adults in the U.S. have genital warts at any one time. This year it is estimated that 12,170 women in the United States will be diagnosed with cervical cancer and 4,220 women will die of this disease. By the age of 50, most people will have contracted HPV but will never know it because 90% of the time it clears up by itself within 2 years. What are some of the ways that someone can prevent from getting HPV? There are several ways that people can lower their risk of getting HPV. The use of condoms, limiting the number of sex partners, being in a faithful relationship with one partner, and getting the HPV vaccination. The only way to not get HPV is to avoid all sexual activity. Tyeasha, is it correct that cervical cancer is the second leading cause of cancer in women worldwide? Yes. Is an HPV one of the major factors for getting this type of cancer? Yes, it is. Is there any type of screening that can be done for cervical cancer in young girls and women? Yes. Having a Pap test is how health professionals screen for cervical cancer. This is the only way to detect abnormal cells in the cervix that may lead to cervical cancer. A Pap test should be performed within 3 years of becoming sexually active, and then every 2 years. I have a daughter and a son and they have both had the HPV vaccination. Can you tell the viewers about this vaccine? There are 2 vaccines that are available that can prevent HPV and they are Cervarix and Gardasil. It is a total of 3 shots given over a 6-month period. The only one that can be given to both male and female is Gardasil. The vaccine is most effective when given at 11 or 12 years old, but it may be given to someone up to age 26 and as early as 9 years old. Mrs. Williams, are there any side effects from this vaccine and how much does it cost? Yes, there are side effects just like there are for childhood immunizations. Some of the common side effects include pain, swelling, and redness at the injection site. Other side effects include dizziness, nausea and fever. As of July 2012, the retail price of either vaccine is about $130 per dose, $390 for a full series. Tell the viewers and audience why this vaccine is so important, and why we're advocating for this vaccination to be mandatory before entering the 6th grade. This vaccination will protect someone's son or daughter from getting cancer caused by the HPV infection. About 6 million people, including teens, become infected with HPV each year. This vaccine can protect your loved ones against genital warts, cervical, penile, anal, and throat cancer. There are only 24 states and the District of Columbia that are requiring this vaccination before starting the 6th grade. I'm advocating that the state legislature of each state who has not considered making this important vaccination mandatory make a change today. Tomorrow may be too late, and a life may be lost due to cancer. I'm encouraging everyone, especially parents, to spread the word and get as many people, including children, vaccinated that meet the age requirements. I challenge each of you to see how many people you can get vaccinated by taking on the HPV challenge and helping prevent someone from getting cancer. Tyeasha, I would like to thank you for coming on the show today and providing such an informative discussion on HPV for our viewers and audience. I would like to thank you, Mrs. Jones, for having me on the show today.